Hello everyone, it's Travis. I want to give you all a quick update on a procedure I had about 6 weeks ago, and that is I had a partial knee replacement. I went back for a checkup with a surgeon today, and I want to give you a little update, an overview about what I've gone through so far. I know when I went through this, I was looking for a lot of information out there, and there's just so many things that are out there, and none of it seemed to be consistent among people and their experiences. And after going through this for 6 weeks, I can tell you it's going to be your own journey on this. I've talked to a lot of people as they've gone through this, and no two people have had the same journey. So I'm going to share what I've gone through so that maybe you can find a little bit of information if you've been looking for it, or at least some camaraderie and commiserating with people who have gone through this before. I actually had this done, again, about 6 weeks ago. I've had knee issues for a while now. About a year ago, I actually went through physical therapy after seeing a specialist on this, and they were able to strengthen the knee in the other area just so I could postpone surgery. But I had bone on the interior of my knee, on the inside here. So I knew it was a matter of time. Earlier this year, don't know what happened. I wasn't doing anything crazy. It just gave. Come to find out it was a torn meniscus. I didn't find that out for about 2 months. That put me through physical therapy again, and the physical therapy actually made it worse. I mean, I was barely able to sleep at night. I was getting maybe 1 to 2 hours of sleep at night. The specialist wouldn't give me anything stronger than Tylenol, gave me some gabapentin for the nerve pain, and it really wasn't cutting it. So they dug a little bit deeper and found out, yeah, I had a torn meniscus on the inside. There was not enough space in there. It was, again, bone on bone. So if they removed the meniscus, it was going to make it even worse. So decided to do the partial knee replacement. I'm sure it's going to be a good decision eventually. I'm still on my way in the healing process. I am really happy though. I'm getting more sleep now than I did prior to the surgery, which is a good thing. They also gave me 2 weeks notice on this. So they had said originally, well, we can't work you until 6 weeks because of the surgery schedule. Then someone canceled and they said, hey, we're moving you up. You get 2 weeks to clear everything off at work, get everybody to cover what you need to cover, let people know about it, get your FMLA paperwork turned in. So that was kind of fun for everybody at the office. They did a great job pitching in, and I've been able to really kind of just concentrate on me for the last 6 weeks, knowing that the folks at my office are taking care of everything. So the day of the surgery itself, I had to be there at 8:30 in the morning. The surgery was at 10, and it's a 2-hour surgery. So get there, you fill out all the paperwork. They take you to the back. My wife was in the waiting room. They would not let her come back at the time. They're really conscious about exposure to things, especially like people bring in bacteria, germs, things like that. So they really kind of limit in the surgery center that I went to. My wife was able to come back like 2 minutes before I was taken back to surgery, just to give me a little kiss and say a little prayer with me before I went back. So they did some nasal swabs just to clear everything out, because evidently that's one of the things that's most likely to introduce bacteria is through breathing. So they wanted to sanitize my nose, my nostrils. So they had to do that. They hooked me up to the IVs and everything that you would normally expect. And then came the fun stuff, which is getting your knee ready for the procedure itself. I had a nerve block done on the knee, and I also had a spinal done. I could have chosen to take just regular anesthesia for that, but the outcome is not usually as good on that. It takes you a lot longer to wake up afterwards, usually a lot of nauseousness and other things that are potential for that. So they prefer to do the spinal, which is fine. What they don't tell you though is that to do the nerve block on your knee, they actually have to find the nerve. I never had one of those done before. And I was nervous anyway because I don't have a lot of surgery. So I'm like, you got to give me something to calm me down before the surgery, before you start doing all those. So they gave me something that did not work very well. So the anesthesiologist is sitting at my knee, and he is taking these needles about this long on both sides of the knee, trying to find the nerves, to kill the nerves, putting anesthesia or whatever they call it on the knees. And he would hit the nerve and my knee would jump, and he would look at me and go, don't jump. Don't wiggle, don't move your leg. I'm like, well, then quit hitting my nerve. I mean, it's an involuntary response. So that was honestly, of everything I went through, that was the worst part for me. So they did that on the outside, then they had to do the inside. Again, least enjoyable part of that. Putting the spinal tap in the back was not a big issue. It went right in. Again, I was more nervous than anything, but they did put the local anesthesia on that, and they did that. Took me back to the surgery room. It was a 2-hour surgery, so they get me back in there, and I'm, had a few things done before. I have had scopes and stuff, and they put the gas on you, and they say count down from 10. Well, when they put it in the spinal, that's how they knock you out, is through that. I didn't get any warning. They just like moved me over to a table, and next thing I know, I'm waking up in the recovery room, my knee up. So they give you the medication when you're in the recovery room. My wife was able to come back for that. I guess, in the recovery room about an hour before they discharged us. You have to go pee before you leave. They're giving you all the instructions, which I remember nothing of because I was just coming off the anesthesia. So make sure you take someone with you who understands. My wife is an RN, registered nurse, so she understood the language. She got all the paperwork, and while I was out, she had gone to the pharmacy because they ordered a pack of medicine for me. It was like their knee replacement special pack that they have. Just a tip on that, because it's kind of specialty medicine, you want to keep it separate. A good idea that we use is just a Velveeta box. Just put your pills in there. Probably keep a notepad also to keep time when you take your medicines, because it's all varied. You take some of them every 3 hours, some of them every 8 hours, some of them once a day, some of them twice a day. And it could be very confusing. So make sure you take good notes on that. Have a notepad ready to write down your pills and when you're supposed to take them. And again, I kept them separate from my other supplements and things, which I've been taking anyway. So you're waking up in the recovery room, and you're just really not feeling it, right? And they're trying to talk to you, and you're not really feeling your knee. The nerve block that they put in your knee ought to last 48 to 72 hours. Mine lasted closer to the 48-hour mark. So after 2 days, I started feeling it. They will give you some narcotics. In my case, they gave me a stronger one and a lesser one to taper down to. In my case, you took each one of them every 3 hours. And then after a week or two, you're supposed to stop or start tapering off of the stronger narcotic and just use the lesser one. You're also taking Tylenol every 8 hours. I took the arthritis strength Tylenol, which I think is 1,000 or 1,100 milligrams, something like that. Go ahead and start taking that even if you're not feeling it. I watched some videos and people are like, oh, I'm having a great time. I'm not even gonna take this medicine. This is the easiest surgery ever. And then the pain gets ahead of them and like, oh, big mistake. I should have been taking this medicine. So just don't try to tough this out. I'm just gonna tell you, knee replacement surgery is probably it's gonna hurt. It is gonna hurt. Your doctor will tell you that, your physical therapist will tell you that, anyone who's had it done will tell you that. It's gonna hurt, and it's not gonna be a fast recovery. Again, I'm 6 weeks in, I'm still having pain. I still don't have full range of motion yet. A little nervous because I'm supposed to go back to work in 2 weeks. We'll see how that goes. So it's gonna hurt. Stay ahead of the medicine on that, the pain medicine. It's also important to elevate. Like, I'm in a recliner, but I also, when I recline, I have pillows that I put underneath there to prop my leg up even higher. Your doctor may give you, I don't even know what it's called, but it's a blue foamy cushion for your foot, has a spot for your foot, and it will elevate use. I had one of those. I quit using that after about 3 weeks because I was able to transition to the pillows and get the same effect. The purpose of that is to keep your knee straight, because at first you really want to keep your knee straight. You don't want to bend anything. As you're recovering, keeping it straight, full out, is actually more important than getting your bend back. A lot of people want to rush into getting the bend in your knee back so you can climb stairs and walk, honestly. But it's more important at first to keep your leg extremely straight. You want 0 degrees is your goal, just straight out. Ice. Ice is your best friend when you're going through a knee replacement. I was able to purchase this through the doctor's office. This is a water cooling system. It has water in the reservoir, ice water, and sort of see there on the back of it, you take this and you strap it to your knee. It has Velcro straps on it that allow it to stay on. So really cool. They will tell you at first to keep this on quite a bit. As you go on, they will say, maybe use it 3 to 5 times a day. I found that I keep it on a lot because that helps keep the swelling down. The faster you get the swelling down, the faster you get the range of motion back. and then you're able to do your exercises. Swelling is going to be one of the biggest obstacles you're going to go through. Swelling and inflammation. There are times when I've just done my physical therapy and it just feels like below my knee is just running a fever, so to speak. It's not, it's just the inflammation in your body fighting that. A tip on this machine, they will tell you to fill it full of ice, and then there's a fill line in there for water. What we did instead was use bottles of water. I'll show you this. So we just use regular, whatever ounces this is, 16 ounces of water here, and keep those in the freezer. And we'd have about 12 of these in the freezer at any one time, or 12 in use. 4 of them in here, and when those defrost and the water becomes a little bit warmer, you take them out. We use the pitcher here because it makes it a little easier. It's going to be a little bit wet, so you pull them out, put them in here, take those, put those back in the freezer, get 4 more ice cold ones that are solid, put those back in the machine, turn it back on. You don't use as much ice that way. It's a little bit cleaner, or a little bit more less messy that way. Anyway, it's a tip that someone gave us, and it's a really good one. As far as ice packs, because that only covers the knee. With me, the knee has been, at first was the big part of it, but I also had they used a robot during the surgery. The robot doesn't do the surgery, but the robot is controlled by the surgeon that allows you to get a much cleaner cut. They're cutting your bone. They are removing part of your bone so that they could put the metal fake knee replacement in. They will drill a hole or 2 holes or 3 holes into your, I'm not a doctor here, tibia, fibula, whatever it's called here. I don't know my anatomy on that, but anyway, the shin bone there, the big one there, and they will put anchor points in there connected with, mine was hooked in with concrete. That's gonna hurt. They do the same thing at the top, and they will kind of clean that underneath your kneecap also. So that's where your biggest part is done. But for the robot, they actually anchor here, down on the leg. And as time has gone on, that's actually when what's hurt me more than the actual knee itself. The knee itself has been tender, but I've had a lot of shin pain right up and down where that anchor part was. The top part of the anchor hooks in at the very top of the incision up here, so you really can't see the separate spot for it, but it has not hurt nearly as bad as the anchor part down on my leg a little bit. So you need additional ice for that. 2 of the ones that we use, again, I'm gonna stand up here and grab these. I'm sure this is one we got at a yard sale through the years. Came from Walgreens, but it is a freeze pack on the inside, and it's got a coating on the outside, like a fabric on the outside. This is great because you can put it right on your skin. That fabric keeps it from getting too cold, so you can put that on your knee, up here on your top of your thigh, wherever you need to. So that's a good one. Another one that we have, this is called the Coldest Water Faster Recovery for Athletes and High Performance. We got this off Amazon. I think it's about 20 bucks, something like that. It literally is the coldest ice pack I've ever felt. I can't put this directly on my skin. I always get like a dish towel or a hand towel and put it on my leg first to kind of take some of the edge off of the cold. It lasts quite a while. I usually, throughout the night, I will keep ice packs on my leg at night. One of them gets warm, I'll wake up from the pain. You know, I've got my clock set to remind me to take my medication. I get up, take the medication, swap out for a new ice pack, come back and try to get to sleep again. So these are some tips to help you get through this. For exercise, they want you to exercise every day. Do some basic things like just sitting in the chair and wiggling your foot back and forth. That'll be one of the first ones that you can do. They'll want you to do some leg lifts where you're just sitting in the chair and you're trying to lift your leg up a little bit at a time. Your physical therapist and your doctor will give you specific regimens, so I don't want to go too much into mine. I will say that when I went to physical therapy, and I went 3 times a week for the first month, and then for the last 2 weeks, I've gone twice a week. Unfortunately, my insurance company did not approve any additional visits, which the physical therapist is not happy about because, as he told me, I'm not ready to give it up yet. I need additional treatment, so I'm in the appeal process on that, unfortunately. He is going to schedule a peer-to-peer meeting with the insurance company's physical therapist, see if we can get a few more visits scheduled on that. I'm trying to appeal the process on my part. It's all finances. Everything in the paperwork says that I should have more of it, but insurance companies are for profit. They don't want to spend any more than they have to, so they make you go through the appeals process, hoping that you won't. But if you push it hard enough, I'm sure we can get a few more visits out of it. But anyway, I encourage you to take advantage of physical therapy. One of the cool things that this physical therapist office has, and it was new to them, it's called a Genuese, Genuese, I think. It's basically a chair that you sit in with a hand crank on top of it, and that works a lever that they strap your leg to, like a little splint thing. And as you crank it, you can crank it up, and then you can lower it back. You want to get to at least 0 degrees straight out. You hold that for 30 seconds. There's a timer with it. And then you crank it down as far as you can to bend your knee. My first time, which was about 3 days after my surgery, I got to 76 degrees. If you think just your leg straight down, that's 90 degrees. Like it was just, just sitting like this. That's like 90 degrees. So 76 degrees, I wasn't fully extended. After 6 weeks, I am able to get to about 108 degrees. Cold, which means before the therapy session. At the end of the therapy session, I was up to 120 degrees yesterday. The goal is 120 to 130 degrees cold. So again, I do have some work to continue to do on that. I'm gonna share another video. My doctor ordered a Romtech bike. So again, look for another video on that. I'll explain that. Do your work on this. Talk to people in the office, though. I know some people tell you don't talk because everybody's journey is different, but by talking to people, it made me feel a lot better about my journey, because it's true. No two people's journey is the same, because I sort of felt, am I failing at this? I'm very frustrated. I think I should be ahead on this. I've had surgeries before in 6 weeks. I'm back to normal. With this one, from what the doctors have told me, the physical therapists told me, and other people who've gone through this, it may be 6 months before I get back to somewhat normal, and it probably is going to be a full 12 months before I'm back to 100% normal, doing the things that I want to do. I talked to one lady, she was probably in her 70s, and she had both knees replaced, her husband had both knees replaced, and all 4 times were different. For her first one, she had no pain afterwards. She goes, I was up doing things, the swelling went down immediately, I was not on pain medication more than 2 weeks, and I was fine. The second one, it was a totally different story. Same procedure, same doctor, and the result was eventually the same, but the process to get there was a lot different. It took her 3 or 4 months to get back to where she was and not able to have to take the pain medicine. Her husband, both of his, completely different, and he was worse with pain than she was, so his recovery was a lot slower. So just keep in mind, if you're going through this, don't compare yourself to anyone else. Your journey is your own journey. Do what the doctor says, do what the physical therapist says. Try to eat a lot of protein. The more protein you have in your diet, the better your healing is going to be. It's going to speed that healing up, because your body needs protein to heal. Try to cut back on the sugar and the processed foods and the junk. That's just general good eating habits anyway. But especially if you're trying to heal, you want to have good stuff healing your knee. You don't need the junk during this particular time. Let's see, what else can I tell you guys? Just be easy on yourself. You will need a walker when you leave the surgery center, and you'll need the walker for at least 2 to 3 weeks. And again, that's just a general thing. You may be on it longer. Your physical therapist or your doctor will be the one to clear you to go from the walker to your cane. And your cane will be your best friend for a couple of months. So with me, I was on the walker for 3 weeks. And he said, you can start using a cane in the house, but if you go out in public, continue to use your walker. And it's really not because I can't walk, it's to protect me from other people, because people just don't pay attention when they're walking. They will run into you, and your balance is not going to be where it needs. Your knee that you had the surgery on, it's not going to be quick reflexes. It's not going to be strong yet. So use the walker to protect yourself from other people, just in case you get knocked off balance. Also, people see that coming, they'll get out of your way, hopefully. After 3 weeks, I was using the cane in the house. About a week ago, week and a half ago, no cane in the house. I take it slow, hold on to the walls if I lose my balance, but within the house, I'm practicing now, no cane. When I go out in public though, even if it's to get the mail outside, I take my cane, because it's just too many opportunities to trip. The yard is uneven, there's rocks, there's whatever. I went to a store yesterday, and I don't go very far, and there was just a real quick trip in, but someone had spilled some powder on the floor, and my cane hit that powder, and my cane went flying out, and I almost fell down. So you just don't know what's out there. So take it easy, take care of yourself on that. Anyway, I think that's about all the advice I have. If you have any other thing else that you would like to know about my experience on this, drop it in the comments below, and I'll be glad to help you out on that. Just again, give yourself some grace. Don't rush this. It's a very intense surgery. I heard someone say that between this and hip, surgeons like the knee surgery better than the hip, but patients like the hip surgery recovery better than the surgeon does. So surgeons hate hip surgery, but surgeons like knee surgery. Patients like hip surgery better, and patients don't like the knee surgery recovery as well. Again, I'm still in pain after 6 weeks. Still taking it easy. Going to see the doctor this afternoon. I may give you an update on what he says, but just hang in there. Take care of yourself. This is your shot to get better so that your future is pain-free and you're able to have the mobility that you want to go do the things that you enjoy in life. All right. Everybody have a great day.